spinal degeneration and joint degeneration. If you're suffering, keep watching, because in this video, I'm going to cover how you can turn back the clock on joint degeneration, like knees, shoulders, elbows, wrists, ankles, quicker than you can say, get me some relief, even if you've been diagnosed with arthritis, bone on bone, or partial ligament and tendon tears. Even if you've been taking pills, getting cortisone injections or gel injections, or had a previous surgery. Hi, I'm Dr. Alan Nathans, and I have been helping people to get to the root cause of joint pain for 25 years. And in that time, I've taken care of more than 10,000 people. I'm the CEO and the leader of our world-class no-needle regenerative clinic, where we get to the root cause of pain symptoms, restore nerve flow, we unbulge and unherniate discs, and turn back the clock on joint degeneration. Our mission is to help you to get off the medical gerbil wheel of addictive pills, cortisone injections, and risky unnecessary surgery, which all create more degeneration, aging you faster and keeping you from living your best 100-year lifestyle today. And by the end of this video, I'm going to show you exactly how we get better than an 85% success rate in treating joint pain, utilizing multiple FDA-cleared technologies and proven protocols that we've created. And we have the testimonials to prove it.
A whole staff from Dr. Nathans down to the last person working in here really makes you feel comfortable.
Highly recommend somebody to take that step if you want to feel better. It's just been amazing for me, amazing.
And Dr. Nathans helped me from being in a wheelchair to where I am now.
Felt like it came from the heart. I felt like a celebrity. But I actually look forward to coming here to get adjusted every week. They just all feel like friends.
So let me explain the old way of treating joint pain. It's the protocols of primary care doctors and orthopedists. It's the patient comes in for an exam, goes for some different kinds of testing, gets put onto a drug to numb the pain, and then gets shipped off for a series of physical therapy visits. They usually return to the orthopedist or the primary care and get more medication or a different one, and they get scheduled for an injection of cortisone to mask the pain. And a cortisone injection is literally like spraying deodorizer on smelly garbage. What if I told you that research shows that cortisone injections are actually known to cause more rapid degeneration in the joint, ensuring a joint replacement surgery down the line, because it's toxic to the tissue, which causes the joint to break down even more. It is a money-making model of care. And this is cookie cutter joint care. Everybody gets the same thing. Pills, testing, more pills. Believe it or not, some cases, nerve burning, and then a risky surgery with a long recovery time. So here's some of the reasons why people have degeneration in their body. There could be a history of trauma, spinal misalignment, spinal degeneration, obesity, overuse and repetitive movements, excess sugar and carbohydrate consumption, believe it or not, diagnosis of rheumatoid arthritis or osteoarthritis, fibromyalgia, autoimmune diseases, and much more. Most people are told when they're dealing with degenerated joints that they only have a few options, like addictive symptom-based drugs, including opioids, invasive and tissue degenerating cortisone injections, don't do another cortisone injection, and irreversible, risky, and painful surgeries with a long downtime of recovery. This is a ride that Big Pharma does everything in their power to keep you on because it's wildly profitable, and I call it the doom loop of degeneration. By justifying with, well, we'll cover this with insurance, or we'll manage it, or you know what, it's supposed to happen this way, or let's try a new drug. It keeps you on a closed loop of degeneration, just aging faster. And every cycle around this loop, the degeneration gets worse and worse, going deeper and deeper, and bringing you into a pit of pain and despair that ultimately leaves people feeling very hopeless, but also missing work, leaving you unable to concentrate sometimes, having neck and back pain or both, giving you brain fog, radiating and numbing pain in the arms, hands, and feet, and legs, and debilitating migraines, among other things. And, it leaves you thinking, like, when am I going to get better? Who can help me? So I want to tell you, first and foremost, we recognize in our clinic that degenerative joint disease is only normal if there's a reason, and genetics play a very small part. So your body was created to age gracefully, actually. And too often when we analyze x-rays, we observe even though the neck and the lower back are connected and in the same spine, they can age completely different. You know, in the dental industry, they have done a great job at showing you how to take care of your teeth. But in the spine and joint industry, it wasn't that way. So what I've done is I've created a no-needle regenerative protocol that I call the Joint Regeneration Method. And the Joint Regeneration Method is a world-class protocol where we craft a customized treatment plan to help you to achieve the best results possible. There's 3 phases of care, and it's part of our core philosophy and the 100-year lifestyle. And you can learn more about our core philosophy in that video that's called Core Philosophy on our website. But the 3 phases are crisis care, the critical transition, and lifestyle care. And in the crisis phase of care, we have one sole focus, and that's to get you out of the crisis, decrease pain, and to get you stable. Next is what we call the critical transition. It's addressing years of neglect and accumulated arthritis and degeneration. And it takes time to do that. So you've got to give your body the time it needs to build back function. It could take months. It can take a year to correct 40 years of degeneration. So as long as you're open and willing to take the time to do that, our protocols are proven to work. And then in the last phase of care, which is lifestyle care, it's all about optimal performance and ensuring that you don't lose the gains. We call it regenerate and protect because we want you to protect the gains that you've made. You know, I like to think of the critical transition in the lifestyle phase of care really as one thing. It's all about regenerating and protecting. We want to protect the gains. It's not an option. We have to protect that, so you have to protect that. And so why does this treatment protocol that we've developed work? It works because we have proven no-needle regenerative techniques that we can actually unbulge, unherniate discs, grow brand new connective tissue and blood vessels, literally turning back the clock on aging joints. We'll take you through a painless examination to get clarity on exactly how we need to approach your unique situation and exactly the protocols and what we need to include to yield customized treatment plan that is going to yield the results. So what we hear all the time from people who end up becoming our patients is that the cookie cutter treatment that they were getting, the visit by visit one-off methods that didn't have a focused outcome that they were working toward, that our method compared is so detailed. And there's a lot of well-meaning doctors out there that offer free one-time treatments to get you out of pain. But listen, you're going to be sold more treatment. Let's just get that out of the way and tell you that it's bigger than you think it is. You deserve better. You deserve to be told the whole truth and nothing but the truth of where you're at and what it will take to get you back to living, back to playing with your grandkids, back to a clear process to results so that you can enjoy your 100-year lifestyle. And here at our clinic, your case is going to be handled by the physician, an office manager, and multiple chiropractic assistants. So there's a lot of touch points here. And I want to tell you that you're an ideal candidate if you're tired of going from doctor to doctor. Like if you're looking for a solution that lasts, if you're committed to fixing your problem once and for all, those are important things. Like if you don't want to be held back by aches and pains anymore and you're willing to invest in your own health, you're a good candidate for us. And you can have the confidence and certainty that every step of the way, you're going to know exactly what to expect. You're going to have a team standing behind you and at your side to help you stay on track. We all have the potential to live our lives at 100%. Whether you want to or not, or you like it or not, you might just live longer than you ever thought. So are you one of the millions who have been getting cortisone injections to manage pain? I bet your situation didn't improve, but has likely gotten worse. So some of you are thinking, it's just too late for me. I can't get any better. Please don't get caught in that trap. That's not right. If you're frustrated and want to improve mobility, flexibility, get pain down, be healthier in the next 5 years than you were the last 5 years, we have an 85% success rate. Okay, 85%. That's huge. You compare that to risky surgeries that are like less than a coin toss of success. We attract the most difficult cases here. And listen, as I close this down, you've got 3 roads ahead of you. One is you can take the path of just doing the same thing that you've always done. Physical therapy, pain meds, muscle relaxers, cortisone injections, gel injections, more of the same, or worse, a risky surgery. So I don't want to see you do that. Or you can do nothing, ignore it, be like an ostrich and just bury your head in the sand. Okay, you're going to get more of the same. It's going to get worse. Or you can actually try a new way, a way of action. So no matter how degenerated or hopeless that you feel, we have pulled thousands of people out of that pit of the doom loop of degeneration, out of the doom loop of depression and anxiety, because they can't move and get out and do what they want to do. We care about your success. And I want to be honest with you, I'm speaking about you. If you've lasted this long and you've watched this video for this long, I'm speaking to you. And if this makes sense to you, I want you to do the next thing, and that is to click to schedule an appointment. Book an appointment with us, and we will see exactly how we can help you to see if you qualify and see if you're a good candidate for our protocols. We want to get good results, and we're choosy on who we choose to work with. So I'm looking forward to meeting you. I really am, and we all want to help you. So please contact us as soon as you get done with this video, and let's get started. Thank you.